Morning, everybody. Eric Chaconis here for the Institute of Clinical Excellence Daily Show. Today we're going to get into some shoulder internal rotation techniques. And first things first is I really want to see somebody present with a specific deficit, a functional activity, internal rotation related deficit to really want to work this, right? Because it's not without risk, you could say, right? There's times where when I put the hand behind the back or even just working shoulder internal rotation up at 90, where I'm putting quite a bit of stress on the top of the rotator cuff. So if I'm working with somebody and I'm trying to facilitate the healing process of the rotator cuff, I want to be real careful that I'm not flaring them up by working shoulder internal rotation. So there's got to be a specific reason, right? I'm not just working internal rotation for the sake of working internal rotation. I'm doing it because there's a specific functional deficit. They say I can't reach behind my back to put my wallet in my back pocket or something like that. The other thing to think about is, and this is more pertinent in the overhead throwing athlete population, but humeral retroversion. So in some people, what they actually have is as they go through the growth and development phase of life, their humerus kind of twists into external rotation. So you'll actually see the humeral shaft is twisted, and so that's termed retroversion, and what you see there is the head of the humerus is more posteriorly oriented compared to the distal humeral condyles here. So that's somebody that I also wouldn't really be cranking on them into internal rotation because it's an osseous adaptation limitation, not a soft tissue restriction. Much more prevalent in the overhead throwing athlete population. There's a number of tests that you can do for that. And ways to look at it. I think that's probably a whole video in and of itself, so maybe we'll do one on humeral retroversion, one of these future PT on Ice podcasts. But today I want to show you more manual techniques. What can you do to try to improve shoulder internal rotation for somebody that you're helping them recover, with shoulder injury? All right, so first thing I want to do is kind of figure out what position do I really want to work. I'll typically test internal rotation in 3 positions. So when I'm doing my assessment, I'm going to look at it up at 90, and I'll typically do that in supine, right? So looking at internal rotation in that position, horizontally adducted, so the arm cross body, looking at internal rotation in that position, sort of like a sleeper stretch type position, and then hand behind the back. Because each of those movements is actually has a lot of biomechanical differences in and of itself. This one, for instance, is quite a bit of shoulder extension. To get your hand behind your back, you actually need quite a bit of shoulder extension. And then you're that's a prerequisite to the internal rotation movement. Horizontal adduction, another one that really stretches the posterior cuff right out in that position. And so there's differences there. So let's go supine first, Cindy. I'll show you, if somebody is very restricted, so there's a very significant limitation, or there's some degree of moderate or even high irritability. Typically, this is going to be typically much better tolerated, right? They're going to tolerate this position a little bit better. So you get them in that classic kind of 90-degree position, and I'm going to work internal rotation in that position. And what I'll do from a manual therapy perspective, right, usually is just like I do with that posterior glide for external rotation. So you guys have probably seen me do that one before. I'm going to prerequisite this with a little bit of a distraction. Using the word prerequisite quite a bit today. I want to distract, right? Pull laterally. I'm going to get them in as far as they'll allow me to go into internal rotation like that. And then it's just a matter, make sure you guys can see, with this other hand of providing the mobilization to the shoulder joint. So you're here, this arm's going to distract, and then I'm going to work posteriorly in that direction. What's nice about this is I can couple movements. So if I feel like I want to bring them into a little bit more of a flexion, a little bit more sagittal plane position, I can do that and mobilize there. I can change this angle of abduction as much as I want to. So I've got her internally rotated here, but maybe she can't really tolerate quite up that high at 90 degrees, right? Maybe that's giving her a little bit of a pinch, a little bit of subacromial pain. Come down here and then mobilize posterior here. I can get towards that horizontal adductive position like that. Right, so I can do a whole host of things, but the key to this one here is distract first, because that usually will feel a little bit better. They get a nice little stretch from that, and then posterior glide them like that. All right? For the sleeper stretch one, so now you're going into horizontal adduction. You're going to kind of work them across the body. And so if I notice a deficit, an side-to-side deficit in this position, that's going to make me want to kind of work across the body a little bit more. So I can say just put your hand on your shoulder, your opposite shoulder there. So that kind of rests her shoulder there for me like that. And then what I'm going to do is just do that same distraction, but now I can kind of pull laterally with this other hand. So I'm getting in here like this, and I'm actually pulling straight lateral, almost trying to picture as if I'm like gapping the posterior lateral quadrant of the shoulder joint like that. All right, so I can work kind of same thing, working horizontal adduction across the body like that. I can increase that internal rotation position. I can have them come down, bring that shoulder a little lower into more internal rotation, and I can bring it like that as well. All right, so sort of that would be a nice one to where afterwards I'm going to work the sleeper stretch. Let's show real quick. So the self stretch at home, most people are familiar with sleeper stretch, but sideline. You got them here, right? And so that's going to kind of mimic that mobilization that I just utilized, and I can have her kind of press that. Got to keep this trunk stacked, right? I want her body upright over top of that shoulder as she works internal rotation like that. All right, the big one, the money maker. Now let's go into seated. Actually, Cindy, I'll have you face the other wall, please. Okay, so this is really where you're going to more commonly see the functional deficit. Is they're going to say, I cannot reach this arm behind my back to reach into my back pocket, to fix my bra strap, you know, a number of things that I'm unable to do with my arm behind my back, regular daily activity type stuff. So what I want to do is first recognize that I got to get shoulder extension moving, right? So I possibly might not even work internal rotation in this position for the first few visits. I'm just going to come back here and work extension. So I'll come in here, a little bit of an inferior glide here, take this other hand, and now I can use this other hand to mobilize the front of the shoulder in the anterior glide. I can do a lateral distraction here. Do a lateral distraction here where I'm bringing that head of that humerus out laterally and anteriorly. And then as that improves, I bring her into the hand behind the back position. Of all these techniques, this is by far my favorite. She's here where she can get to, sort of comfortably, into internal rotation like that. And then what I want to do is I'm going to inferior glide the shoulder joint down like that. Yeah, so you guys can see. Inferior glide down like that. And this proximal hand is going to work in that lateral distraction, sort of stretching lateral like that, with the inferior glide. Oftentimes I'll want to try to stabilize or kind of control the acromion here. So control the acromion, the scapula here, and then if you're able to, with one hand actually provide the inferior glide, right, like that, inferior glide, and then lateral distraction there. Some people will put a belt, they'll actually put a mobilization belt around the elbow here. That'll kind of give you can almost use your foot to control it to pull down into the inferior glide while you're creating that lateral stretch like that there, okay? Follow up, obviously a lot of people are using the towel stretch where you're having them grab a towel and pull up behind their back like that. Cross body horizontal adduction stretch, we'll slide this way real quick, would be the other one where you're just, you know, for a home kind of self stretch, right there. And this is the other one that's been looked at in that overhead throwing athlete population quite a bit, where they'll do that cross body at horizontal adduction stretch and also the sleeper stretch. Those would be the two ones in that overhead throwing population. So hope that helps. Any questions, reach out. Don't hesitate. What's coming up? We're in Las Vegas, the July 14th and 15th. We're in Las Vegas at Physical, at the clinics that RJ manages out there. So we are really looking forward to that with the Physical group. That'll be a lot of fun. I'll be at APTA Next in a couple weeks. So if you're at APTA Next, come check us out. Mark Bishop from University of Florida, myself, and Ahmed Rashwan. We're all going to be presenting on really the physical therapist's role in addiction recovery. So there's a lot of examples nowadays of physical therapists that go into addiction recovery facilities where people are recovering from substance use disorder, opioid use disorder, stuff like that. And, nobody's really managing the physical aspect of their recovery. So a lot of times there's co-occurring musculoskeletal injury and pain, and these guys go into those facilities and treat patients in those facilities. So it's a neat model. I think what we're doing as a profession is very, commendable. It's wonderful. I think everything that we're doing on the front end, right? Choose PT, prevent the opioid crisis, come see a PT instead of taking pain pills. But on the back end, there's still 20 million Americans that are suffering from substance use disorder. And so what do we do? How can we help those individuals? And how can we be part of the healthcare team that's already in that setting and bring our skill set in there and help out as best we can? So that's what we're presenting on Thursday at 3 o'clock. And then also, if you're really interested in it, there's still time to sign up for our pre-conference course, which is a full day showing you the model and exactly what the PTs are doing in that business model on Wednesday before APTA Next. So hopefully I'll see you at APTA Next, and have a great day.